Proposition 29, it requires on-site licensed medical professionals at kidney dialysis clinics and establishes other state requirements. Excuse me. The ballot language is here. So the way it is now is if a person's kidneys stop working, they may need a treatment called dialysis. In California, licensed dialysis clinics usually provide dialysis. When a person is receiving dialysis, their personal doctor must visit them at least once a month. Most patients have dialysis treatment paid for by Medicare and Medi-Cal. Sometimes private insurance is used. Private insurance pays higher rates for treatment than Medicare and Medi-Cal. Infections that might be caused by dialysis must be reported to the federal government. So if 29 would pass, clinics would be required to have at least one doctor, nurse practitioner, or physician assistant present during all treatment hours. They'd have to report any dialysis related infections to the state every 3 months. Clinics must disclose who owns the clinic to the patients. They need permission from the state before closing or reducing services, and clinics can't refuse to treat patients based on how they are paying for their treatment. So a yes vote means that chronic dialysis clinics would be required to have a physician, nurse practitioner, or physician assistant on site during all patient treatment hours. A no vote would mean chronic dialysis clinics would not be required to have a physician, nurse practitioner, or physician assistant on site during all patient treatment hours. And the fiscal impact would be that increased state and local government costs, that there would be increased state and local government costs, likely in the tens of millions of dollars annually. So the main supporters, I actually was surprised that there were not as many major supporters as I had expected. So the supporters say that requiring a physician, nurse practitioner, or physician assistant to be present during a dangerous procedure like dialysis is common sense and a matter of patient safety. Dialysis clinics face fewer inspections than other health facilities, and deficiencies are often uncovered. And big corporations operating dialysis clinics can easily make the required staffing changes and still profit hundreds of millions of dollars a year. So the major funders are the California Democratic Party and the SEIU, United Healthcare Workers of the West. The major endorsements are the California Democratic Party and the California Labor Federation. So the opponents, sorry. Opponents say that clinics already use specially trained technicians, and every patient is under the care of their own kidney doctor, so more oversight is not necessary. They say that Prop 29 would take thousands of skilled medical staff from hospitals where they're needed and place them in administrative jobs. And that Prop 29 would take thousands of skilled medical staff from hospitals where they are, okay, wait, somehow I put the wrong thing in there. Let me find the other one so I can at least tell you what it is. I don't know if you can see what I'm opening. Okay, hold on, let me try here, because these came from League of Women Voters. Obviously, I copied and pasted wrong. Okay, so the third one is on-site administrators who do not provide patient care would cost hundreds of millions every year, forcing clinics to reduce hours or close. So before I send this out, I will obviously fix that. And now I can't get back to, there we go. Okay, so let me go back to full screen. Okay. Sorry about that. Okay, so the major funders are all in the dialysis field. U.S. Renal Care, Fresenius Medical Care. I don't know if I'm saying that right, but Davita Kidney Care, Satellite Health Care, which is also a dialysis corporation, and then Dialysis Clinic Incorporated, who says they're nonprofit. I don't know much about them though. I didn't have time to look into all of that. Their endorsements are all medically related. A lot of them related specifically to kidneys. So yeah, I mean, that's kind of it. These are all the endorsements, which something looks funky here, so I'm going to clean that up too. But it's, I mean, it's basically American College of Surgeons, American College. Oh, I guess there's a lot of American College of Surgeons. Renal Physicians Association, Network of Ethnic Physicians, Chronic Disease Coalition, American Nurses Association, American Academy of Nephrology, which if you don't know what that is, because I actually didn't until earlier this year, nephrology is basically the department that handles kidney doctors. My dad has a kidney doctor, but he's not on dialysis. So he has a nephrologist that we see every 3 or 4 months. So that's kind of it. I think that there's probably a lot of discussion to be had on this one. I'm going to let all of you guys discuss it out. And I don't know that I have anything to add from what you guys would say.
Hey, I did have a question. I believe 2 years ago, if I'm remembering correctly, there was a similar measure that was being voted on, and I don't remember if that passed or not, but it sounded really similar to this.
It failed.
Yeah. Okay, so this is a revival, more or less?
Yes.
Okay.
And there's been significantly more funding pumped into the no campaign than the yes campaign. I mean, in theory, it sounds like a good idea. And I was initially inclined to support it. But I would say just, I mean, over the last month, I've had a whole lot of experience with hospitals, more than I would like to have the rest of my life. And I know that's not realistic, but even like the major hospitals, they're like severely understaffed. And so I do kind of have to agree with the argument that it would take skilled medical staff from hospitals where they're needed. I mean, I do kind of agree with that. But I don't know the statistics on how many infections happen in these clinics. Nobody seems to mention that.
Just as a point of reference, and this isn't to say positively or negatively, but those clinics are under the same regulatory standards and frequency as a dialysis unit in a hospital, so they're not under-regulated. Now, are all services receiving adequate regulation? That might be a question, but they are not less regulated than a hospital dialysis unit. So, you know, they do receive the same standard of regulation as a hospital dialysis unit. So
yeah.
So, you know, and I do find it interesting that there are no medical professionals supporting the measure. All the medical professionals are on the other side. So, you know, it feels like if this were medically necessary, somebody would break ranks and go to the other side.
I'm inclined to agree with you. I mean, if you look at the supporters, it does seem to be about labor. And if it's about labor, maybe there's something else we could do.
There is some question if this isn't an intended, if this isn't intended to give them an opportunity to create a different structure that would allow them to unionize the technicians,
Yeah.
which may not be which in and of itself may not be a bad thing. I'm not sure if this is
Because I do think that people there are probably underpaid. I
and
would say the same thing about the skilled nursing facilities that I
so,
also have too much experience with.
yeah. I'm just not sure if this is the ideal route to go about it.
Yeah, I think just like with teachers being a shortage right now, doctors and other healthcare professionals are also very short. Like I've seen it, all too much. And you can really see the exhaustion in their faces. So I am still undecided on this, and I know that we're trying very hard to present a nonpartisan view. That's why I was using Ballotpedia and Voters Edge, which is from the League of Women Voters, as primary references, and then also the websites, because they do a lot of work for us ahead of time. And that's also why I included them here so people can look and see for themselves. And I think once it's a PDF, they should still link, I hope. If not, I'll include a document with all of the links to make sure people.
You know, Cheryl, your one question is very interesting that nobody has used. That is, what is the infection rate in a freestanding clinic compared to a hospital setting? Because that would be for me a huge deciding factor. If they are experiencing greater infection rates because there is some challenge by not having higher quality.
And that's not even an argument on the supporters.
No, that's what I mean, that's why I'm questioning if that statistic does not lend itself to their argument, or they would be using it.
Yeah, so I'll do more since we're gonna have to schedule another session. I'll do some research and see if I can have some answer on that before we do that. Let me make a note to myself. I'm gonna go ahead and stop sharing my screen. I think.
I'd say your primary point of change here is that they're putting a more skilled professional than just the people working at the clinic, inserting them into that environment, which yes, will take those professionals out of hospitals where they are needed. What is the benefit of inserting that professional into the clinic environment? And if there's enough benefit, then maybe it's worth doing. But as we've been saying, no one has really outlined what that benefit is and if it's worth reducing staff at hospitals. So, because I think that would be the primary mode of choosing yes or no in this one.
Right, because then you've got an administrator or a manager, because you're not getting a one-on-one physician. You're not putting enough physicians to replace technicians. That wouldn't make economic sense. Because then all of a sudden, wouldn't the cost of care go up? And that wouldn't make logical sense. And again, the skilled technicians, my assumption is that these are just that, skilled technicians, people who actually know how to do this and do this well, because they're specially trained for dialysis. So we're not talking about someone who's a minimum wage worker. We're talking about somebody who has specialized skills.
Do we know that for sure?
I don't know, that's the question, but that's, I mean, the way they're describing it, it does sound like that, you know, they're not calling them. They're not even calling.
Well, that's sometimes subjective too.
Okay, that might be the
Because
other
if
thing
it's
to-
like the company training them, then it's like, is it
Or is there
specialized because we
certification?
walked you through it once, watched you do it and signed off that you're okay to do it? Or
Or
is
is there an actual certification that
certificate?
that
Yeah.
is issued by some agency that says, no, you're a certified dialysis technician?
So Victor put in the chat,
It's a breakdown of Prop 29 from Cal Matters. They do a really good job of breaking down all the propositions. So in that breakdown, it actually goes more in depth with what the measure does. So it would require the dialysis clinics to have at least one physician, nurse practitioner, or physician assistant within 6 months of relevant experience available on site, or in some cases telehealth. It requires clinics to report infection data to the state, as well as physically list physicians who have ownership interests of 5% or more in the clinics. It also prohibits clinics from closing or reducing services without state approval, and from refusing treatment to people based on their insurance type. So there's like more aspects to it that kind of help push for the reason why the SIU, Healthcare Workers West, and the labor movement are kind of supporting this 29.
Okay, so that the closing part feels like the part that's could be most critical for patient care, because closing a clinic would have a huge impact, especially in some communities where traveling to a clinic further away would have a huge detriment for some patients, especially if they're using public transportation.
In the during the presentation, I think in the bill language, it was those clinics cannot close down or reduce services without permission from the state. So my question is, would that happen?
And I don't know at what levels that's happening now. So, but yeah, feels like this
Yeah,
is
'cause
worth
it-
looking deeper.
Yeah,
Well,
because
I'd love
if the
to revisit this more.
Yeah.
Yeah.
Yeah, I think we need to do more research.
Yeah, I think it'd be great. I'm learning. So it's good stuff.
I know.
I'm sorry, Seth, I cut you off. It was the way you were going to say. I'm sorry.
oh no, it's was I guess more thinking out loud. That's fine.
Okay. Yeah, because as I'm listening to people, I'm gathering that stuff too. Because the most compelling one was that couple commercials I see, like, "Oh no, my clinic's going to be down. There's no place where I'm going to go. I'm going to die." That was a pretty effective, ad, I would say.
I was seeing those commercials as well, and 2 years ago I was seeing them as well, and I was torn on this issue 2 years ago. And just like, but if the state is not going to let them shut down and say, well, you have to have this staff, and we're not going to let you reduce services or shut down, you're just going to do it, then that argument kind of becomes moot. And so that's, but is it necessary? I don't
Right.
know. Like, that's where the research is.
Yeah. Thank you, Victor. That's very helpful. Victor put
No.
some more.
Yeah, I'll add the Cal Matters links into my resources as well.
Yeah, and also, I mean, the issue with those commercials is they're misleading, because it's not as if these clinics are going to close down because of adding new staff. This is a multi-billion-dollar industry that's basically owned by two companies, and so when they're making those statements, they're saying that because it's up to their discretion, right, to close down those clinics, right? Because DaVita and Fresnisius, or whatever they're pronounced, they control 3/4 of the dialysis clinics across the state of California.
Yeah.
And so in that aspect, it's up to them if they want to open or close more facilities. It's up to them on how they kind of dictate how they hire staff and all that kind of stuff. So, for the nurses union and folks and the healthcare labor unions, for them, they just want more accountability on their part and making sure that there's adequate care at those facilities, because during the process of dialysis, there are possibilities of infection rates happening and things like that. And You know, you need a medical practitioner on site in case there is an emergency or you know, something bad starts happening to those folks who are receiving that medical care they need. And then also they are able to, you know, discourage folks from using their facilities if they don't have adequate health insurance, right? And that's a huge issue in regards to this because, you know, in regards to dialysis, like this is a life-saving procedure that needs to be done for folks. And it's not like you can go without it, right? If you're at that point.
Okay, well, we're learning. I'm learning. I'm gathering info.
With that little bit of information, I think it doesn't make a difference for this moment, but I think I'd like to see something trying to break up that 3/4 ownership monopoly. Then I think that would be a priority as well.
Right, yeah. Yeah, that makes me nervous if I ever was on dialysis, knowing that somebody held my life-giving treatment in their hands like that. Yeah, doesn't feel good.
So for Prop 29, what I did research and tried to find the answers to some of the questions that were posed at the end of our last discussion. What I did find was the leading cause of death for people on dialysis is actually sepsis, blood infection, which is exacerbated if there's like, I guess, 2 different kinds of dialysis. And if you're on a kind of dialysis where they use a catheter and put it into your blood, you're like into your vein, then you're more likely, you're at higher risk, I think, of sepsis, of developing that. The overall percentage of people who get it is fairly low, but it's a big freaking deal when it does happen. I could not find anything to support that these dialysis clinics have a higher rate than hospital. That doesn't mean they don't. It might just mean that the data isn't widely available. Sometimes it's hard to find like research articles or things on that if you're not a doctor. The other thing is, so 2 organizations do own 3/4 of all the non-hospital dialysis clinics in the state, which is huge. And so I couldn't find anything to support. They have, clearly they have a ton of profits, or they wouldn't be funneling all this money into defeating this proposition for, I think, the 3rd time. I think most recently it's been twice, but I think in 2014 it was on the ballot then, or maybe 12. It was on the ballot again before the one that was like last election. So they're really invested in not having to spend more money, but I think it's about profits. Like that's what it seems like to me. That's my own general feeling. I guess there was enough going on and enough other research that I had to do for these presentations that I'm not going to say I did a thorough review of every possible resource out there, but I did spend a good amount of time kind of going through trying to see like causes for dialysis clinics closing and things like that. It does seem to be like, oh, we're not profitable enough, so we're gonna close you. But so now I'm switching from information I found to kind of my own opinion. I want to be clear on that. What it seems to me is that these huge, very profitable companies where they have kind of this oligopoly, which is like a multi-company monopoly, but a small number of companies. So this oligopoly doesn't want anything to affect their profit numbers. And so they're threatening, this is my take, they're threatening, hey, well, we're going to close these clinics in these more rural areas where it's not as profitable because you're going to make it even less profitable, which is why I think the state put the subtext in there where it has to be approved in order for it to close. So I still don't necessarily know what the right answer is, but that's the feeling I get. Like, these companies are saying, well, fine. You want to make it harder for us to run our clinic or not as profitable when we're already making a ridiculous amount of money, then we're just going to make people hate you. I don't know. That probably sounds ridiculous, but
Actually, if I'm not interrupting,
no, I was done. Go ahead. Thank
okay.
you.
I mean, that gives me a good thought that so if these companies can shut down any of the dialysis clinics they want at this point, nobody can stop them. They can just shut down whatever clinics they feel like, and they can do it for, oh, we don't have enough people out here, it's too rural. We can send them to this one where we'll make more money because we don't have to hire staff. But if this were to pass, then they can no longer do that. If they say, oh, this dialysis clinic doesn't happen to be making money out in this rural area, they aren't allowed to shut it down. It has to stay there unless the state says they can. And I mean, I think that's an enormous benefit. I didn't have that thought until you were just talking about it, but just the fact that the state can say, no, that has to stay there, you can't shut it down, when otherwise they might have, I think what is a huge benefit to people that are going through dialysis.
And think about it, an inner city clinic where it's close to public transportation being removed. And now someone who relies on public transportation who needs dialysis, how do they get their dialysis? You know, it really is important because it affects people who have good insurance and money. This isn't going to affect them. They're gonna get dialysis at a hospital. They're gonna get dialysis. They have choices. People who are the majority of dialysis patients are Medicare or Medi-Cal, and so this also requires them to take patients no matter what their insurance. So it doesn't let them cherry pick their patients either. And so that again can be very important.
Seth, to what you were saying, that was actually the point I was trying to make, and I was not doing a good job of using my word thingy right here. But yeah, I was exactly trying to make that point. Like, they're pandering to people's ethos to what seems like based on what seems like a lie, because this proposition would keep them from closing the clinics. Well, too bad, clinics in the red. You have these 75 other ones who are profiting, 150% or whatever. I don't know how the percentages work when you're talking about that on a corporate level, but half of everything coming in is your profit. Is that 50 or?
You're saying that a single clinic might be running at or below profitability, but if 8 clinics are running at triple profit, you can afford to keep that one open because it's being subsidized by your other clinics.
Yes, absolutely. And that's what it seems like to me is the reason that piece was probably put in to solve this problem, but they're basically running the same commercials they ran before. I mean, they're probably updated. They'd have to be because it's a new number, but it's basically the same script.
Well, this raises, to me, I think, Seth, I never really looked at that from that point of view, but I'm willing for the government to impose certain regulations to keep a clinic open. You have a choice to get a contract to do dialysis business here under these conditions. Let's keep it open, even if the profitability is decreased. I kind of like that, to be honest with you.
And I actually just had a thought from the other direction. If they're not allowed to close dialysis clinics, that might also deter them from opening new ones to begin with.
Yeah, I was thinking that too.
I don't know. If there's enough profit, I think they'll open them regardless, but it might keep them out of more rural areas. So there is that as well. That's potentially a side effect. But we don't know if that will actually happen.
My sense is that initially this will be it will be a difficult transition for them because they're going to have to increase their personnel. But in 3 years, it will be the new standard and people will forget that it used to be a different way and they'll function quite well under the new standard.
So Cheryl, what union is all in favor of Prop 29? Wasn't it the nurses union?
Yeah, let me pull up the slideshow and then we'll go right after this. We'll go into the next
All
part
right.
of the presentation. Welcome, George. We were just kind of getting caught up on some lingering questions from some of the other presentations, but we're about to start the good stuff. No, just the new ones. Sorry. Okay, I'm gonna just kind of click through. Okay, so 29 UHW. I misspoke it earlier when Cynthia and I were talking. I knew it was.
No, who are they? What's UHW? United Health
Oh.
Workers? Is that what it is?
Yeah, that's what it looks like, the United Health Care Workers. And this is specifically United SEIU, United Healthcare Workers of the West, which I think includes California and Nevada.
And do we know how
Possibly
big
some of
that
those.
organization is? And
It's pretty big. I don't know the exact
Huge.
numbers.
is it?
I can look that up.
Well, that matters, you know. That if it's if it's 3 people, I don't care. But if it's like
Well,
300,000.
I think they're trying to unionize the thousands of workers that work for.
The dialysis technicians.
They're not really unionized.
No, they are not. And they do not fall under they're not nurses, they are technicians. Although they do require, I looked up the requirements, they require a bachelor's degree and an additional 12 to 24 months of training and a certification and a 12
that's good.
apprenticeship. So
Okay. So
they call it an internship. So they are
add it to the
trained
game
technicians.
a little bit. It's delicious, by the way.
So they're well-trained technicians. They have training that would be, nearly equal to an RN in terms of length of schooling, but it is very specific to the things necessary to oversee dialysis.
Right. So Cynthia, as to that, are they saying that they want to be able to unionize?
That is I've spoken to a few people and there is a great deal of strategic belief that is a lot of what this is about, is creating, for whatever reason, this is creating some opportunity to unionize those workers.
Okay.
Maybe by putting an RN on site, that opens up the whole clinic to unionization.
Yes.
I don't want that to be taken as fact.
Yeah. Well, it
But,
establishes
That might be why, if they're not considered on the same level, and that's what's preventing them from being unionized. Maybe that's part of it.
Yeah.
Wow. Well, good discussion. Yay.
I would agree. We're such smart people.
Yeah, many of the doctors and nurses feel like this is unnecessary, that the technicians provide sufficient oversight. But it also, there's no, the doctors, the nurses, or the nurse practitioners would provide a layer of management oversight. And so,
So do we have any like medical associations, doctors association opposing 29?
yes.
Okay. And who
A
is that?
lot, actually. Real quick, I just wanted, can you see a blue dot? Do you guys see a blue dot?
Yes, we can.
Okay, I wasn't sure if you could see that or not. I was like up here looking for a pointer at some point. So this one right here, Fresenius Medical Care and Zavidia, those two companies own 75% of the dialysis clinics.